The document is a start to a new pathway with key milestones along the way. It aims to take a holistic look at cause and effect, at triggers and social issues, and at children and young people. It builds on the Mental Health Situational Analysis Report commissioned from Public Health England last year. The initial focus puts the patient first, through patient-centred care, in which they're involved in their care plan, as well as promoting self-care. It aims to empower patients to thrive independently, but within the community. There is also an emphasis on tightening up admin and improving both access to care as well as its coordination.
This is the first time that we've actually had a consolidated strategy on how we deal with mental health, and it's a long-term strategy. It's a 5-year strategy. So it means that the priorities are phased with a view to them being delivered within a fixed time frame. We've made the strategy a public document so everybody knows what to expect and everybody knows how we are delivering this. One of the fundamental changes will be greater investment and greater focus in early intervention, and therefore preventing a lot of admissions to Ocean Views by offering the support at the first signs of a problem. And of course supporting people so that they can live better and more comfortably in the community.
I don't want to harp on, I know that we did an interview the other day, but we talk about the professionals available. You say that there are more than ever before. Will people get a chance to actually see this?
Yes, I think that particularly given the work that we've done in the last few months, because in addition to working on the strategy and a long-term vision, we've also done a lot of work at an operational level, and there have been restructures and there have been changes to the way that people work so that we can maximise the time available from the resources that we have. When we look at our service in terms of resources, in terms of people, our people are very good and our people deliver a very good service. Because we've changed the way that they can be accessed by the public, it will result in more of their time being available so that they can be with their patients. I'm confident that we will see a lot of changes very, very soon. And if we don't see the changes, and if anyone continues to have a complaint, then I need to know about it, because we've invested a lot in these structural changes. So if they're not working, then I'd like to know.
The Wellbeing Strategy aims to ensure those suffering from mental health not only receive the help they need, but also the support they need. This will be done by a multi-agency approach. But key agencies within this will be the service users themselves, who the strategy aims to empower, as well as each and every one of us within the community.
Yes, and that's why this strategy has been prepared by the Ministry for Health, and the external experts who we engaged have been engaged by the Ministry for Health. They then have worked with all the key stakeholders who deliver mental health services in Gibraltar. The primary organisation that delivers mental health services is the GHA. The GHA is where most of our therapists, psychologists and psychiatrists and mental health nurses are based, but there are also other services who offer mental health services, such as the Care Agency, also through the Department of Education. And then beyond that, we've got other public bodies who are the stakeholders in the mental health services. Housing is extremely important, as is the police, as is prison. What we want to make sure is by having a national strategy, which is all-encompassing, it will look at the demands and where they are, and make sure that we meet those demands through the services that we have.
The national strategy is backed by legislation, with a draft code of practice to interpret it in its final stages. It's expected to be completed by the end of the year.